Obstetric fistula is an injury that happens to women during childbirth. If a mother is in labor for a long time, a hole between the rectum and vagina, or bladder and vagina, can develop, called a fistula. This hole causes a flow of urine, feces, or blood from the vagina. While the baby is stuck inside, the head presses against the wall of the mother's uterus. This cuts off the blood flow to the mother's vagina and surrounding area. This causes the tissue, the living cells in one's body, to die and rot away. Fistula is a condition that happens to women predominantly in poor countries where access to healthcare is limited. Uganda is a country in East Africa. It is one of the poorest places in the world. There are over 140,000 women that live with fistula. This means that 1 in every 50 women have fistula.
Obstetric fistula is caused by a prolonged labor. Prolonged labor happens when the baby is too big to fit through the birth canal. This is very common for young women because their bodies are not fully developed. When a woman's pelvis is not finished growing, it may not be wide enough for the baby to pass through it. You should seek help if your labor has lasted longer than 12 hours or you have been pushing hard for over 2 hours. Other causes of fistula include poorly performed abortions, fractured or underdeveloped pelvises, bowel diseases like Crohn's disease, which make the intestines not work properly, episiotomy, which is a surgical incision made to widen the birth canal from a previous delivery, or sexual abuse and rape.
A woman is put at higher risk for developing fistula if she gets married and decides to have a baby at a young age, because her body has not fully developed yet. Not all women and young girls have access to proper birth control. This can lead to women having multiple births close together, which can put the woman at higher risk for developing fistula. Sometimes, women in the village do not have access to a doctor or a traditional birth attendant. Not having regular checkups can lead to complications resulting in fistula. If the woman does not have a proper support system around her, such as family and friends, she may not get the care she needs during her pregnancy. It is important to have someone there when the woman is going into labor so that she can access a birthing area in a timely manner, and so that she does not develop fistula. If the woman seeks out a village health worker, she can find out if her baby is in the correct position. If the baby is head up or sideways, this is an indicator that the pregnancy will be more difficult and could result in fistula.
There are some things to notice when examining a woman for fistula. Is she leaking feces, blood, or urine from her vagina? Sometimes this only happens at night. If you can't tell, the normal liquid that comes from her vagina might have a bad smell. This is also a sign. Does she have problems with discomfort in her vaginal area? Does she experience pain when having sex? If she has all of these things happening at once, there is a good chance she has fistula. If she has had it for a long time, she might have burns on her legs because of the leakage. She might also have problems moving because she doesn't want to or because it is too painful. Sometimes a woman who has fistula doesn't want to walk around a lot because it might make it worse. If she has been living away from her family and her community for a long time, they might be ashamed about her condition. Talk to her family. Reassure them that you want to help her. Be kind, caring, and respectful to everyone involved. It is important to know that fistula is not a punishment. She has not done anything wrong to deserve it. It is a medical problem that a doctor can fix. It is not a disease or contagious. It is not an act of God because she has done something wrong. If the woman's family has excluded her and her husband has left her, now is the time she needs the most help to deal with this problem. Explain to her that good food and lots of water will help her body fight off infections. This is very important for her if she has fistula. Make sure she stays clean. She should wash herself every day, twice a day if possible. If she has burns on the inside of her legs from the leakage and it is very painful for her, give her some aspirin or use warm salt water 3 times a day to help fight the infection. Antibiotic cream can be used, which helps fight infections as well, and it also keeps the wounds clean. There are hospitals that perform surgery to reconstruct a woman's fistula. Where this is done needs to be made known, as women are unaware of the option because of their isolation. Therapy can be given to repair the emotional damage a woman has gone through as well.
Prevention is important in ending fistula in rural Uganda. Prevention is cost-efficient, sustainable, and effective in the campaign to end fistula in rural Uganda. An increase in training of village healthcare workers in rural Uganda is important at reducing fistula. One of the best methods for preventing fistula is having access to medical care. The most common cause of fistula, as mentioned, is prolonged labor. A cesarean section can be performed when pregnancy is at risk. When a mother is in labor for a long time, an incision can be made across the mother's belly and uterus to deliver the baby without threatening the life of the baby or the mother. This means that a healthcare worker, midwife, or doctor needs to be present for delivery to reduce risk. Village health workers should educate and counsel women and girls on how to have a healthy pregnancy. It is important that you eat enough during your pregnancy. Your body is carrying another person, so weight gain is normal and important. Eating healthy diet that is rich in protein, vitamins, minerals is also very important for your baby's growth. Personal cleanliness is important. Wash your hands with soap regularly. Bathe often, especially after sweating. Wear shoes and brush your teeth every day. It is also very important to get enough sleep. Your body is working very hard for the baby to grow and needs rest. Being in contact with a health worker during pregnancy is an easy way to make sure things are going well along the way. Village health workers should also educate women and girls on issues related to family planning. It is up to each family to decide how many children they would like. There are several methods you can use to prevent pregnancy. These methods are called contraception. Birth control is one of the most effective forms of prevention when taken correctly. Village health workers should encourage women and girls in the village to form and join women health groups. This will allow women to share ideas and help each other. Fistula is not only a women issue, therefore men should be encouraged to join discussion on the issue related to fistula. This will reduce the stigma.
Here are some resources and places you can go to find more information about fistula in Uganda. Let's spread awareness and end obstetric fistula by spreading knowledge to help those in need.